Ms. Capps, our Vice Chair.
Thank you, each of you, for your presentations. It's been a good panel. You waited a long time, many of you, because it's been a very long day of presentations and different panels on this topic of healthcare reform. I have questions for two of you because there's not enough time, only 5 minutes. My first question will be for Mr. Rivera with SEIU. In your testimony, Mr. Rivera, you expressed that individual responsibility must be augmented by measures to ensure affordability. It seems fair to think that our healthcare system should meet hardworking Americans halfway. For this reason, SEIU supports affordability credit for families between 133% and 400% of the federal poverty line. Why do you believe it's necessary to offer these credits for families up to 400% of the poverty level?
Well, part of the problem that we have is the incredible cost of healthcare these days. For example, in the case of SEIU, almost 50% of the members of our union basically live on very meager means, less than $35,000. So when you take into account, on one hand, the high cost of healthcare and the disposable income, you see that basically, in order to make it meaningful, you have to have subsidies.
So for you're talking about your workforce.
Yes.
Hardworking men and women with raising a family and trying to have a quality of life in this country, not at all luxurious, but still they're doing essential work in their communities, and they should have a decent healthcare system. And so you're wanting to provide that.
As a matter of fact, the overwhelming majority of Americans who don't have healthcare coverage are working people who make more money than to qualify to Medicaid, and are not old enough to qualify on Medicare. And then the question that they have,
which shows you one of the disparities, that the premiums are so expensive that you really, if you're going to have your own private insurance plan, if self-employed or whatever, you have to be upper middle class or wealthy in order to pay for it. And that's one of the major challenges that we face in this country right now. I'm sure you would say that. Are there some other protections? We're talking about middle class, right? Or at least what we want to consider as the middle class, the working class, the hardworking people who keep this country going, whether in small businesses or in large companies providing labor or providing management. What other protections do you believe are necessary to make health care more affordable for the middle class?
Well, I think
this is a big question, but I want to also move on to another.
I think the fundamental question that we have is that we're spending 17.5% of our gross domestic product in healthcare, and if we do not, and I think my colleague Mr. Shea was talking about, if we don't resolve the problem of the cost controls, we're not going.
I see other people nodding your heads. I mean, is this sort of a given? That this is one of the major challenges that, and one of the reasons that you're participating is because we need reform to deal with this in some aspect. I really appreciate that, and you are a very diverse group. I might add. I think there's quite a cross section here, and that's interesting. I would like to now turn for the last couple minutes to you, Mr. Shields, just some particular questions about what you were talking about. Your analysis suggests that a public option can get lower premiums than private plans. Some of our colleagues are come to the conclusion that this disparity, that a private plan is not even going to be able to compete with a public option. Does your model assume that private insurers and large employer purchases are simply price takers with no ability to add value or change behavior in a competitive market? In other words, is it so monolithic in that private world that there is no ability to compete?
Well, we don't conclude that they cannot compete. We conclude that there are only certain types of plans that could compete.
Mr. Shields, if you want to turn that on and bring it closer to you.
Okay. There are only certain types of plans that could survive, and those would be integrated delivery systems, like some of the better HMO type models. A lot of Americans.
Dylan, you did that in the toilet?
Whoops.
Out of order.
I'm sorry, there's a little glitch over here, I think.
Fascinating glitch.
Let's not take that off my time either, okay?
I'd like to explain that, though, because
Please.
there are some key issues here. Right now, a lot of the insurers get price discounts with providers.
Right.
Having to do with the fact that they make volume discounts. They say to a hospital, I'll bring you all 100,000 of my people for their hospital care if you'll give me a break. Now, if everybody goes to the public plan and the health plan, private health plan only has 10,000 people left in it,
Well, the public plan is not going to be able to offer that, is it? I mean,
but
that's pretty competitive.
I wanted to finish my point.
Sure.
My point is that there's only 10,000 people left in the private insurance plan. Then they're not going to be able to negotiate discounts that are as deep
And that's
as
the
what
only-
they can get today.
And that's the only way they can be competitive.
Right.
I would hope that there'd be a lot more creativity within the private sector. I will get to you, but you said I could have a little more time because of that terribly disruptive moment there. Anyway, maybe you or someone else would comment about some of the larger markets like Los Angeles, New York City, private plans bidding below Medicare fee-for-service levels. How do you factor that into the model? And then I'll open it up if there's time.
Well, there are places where there are smaller disparities between Medicare and private. And then there are places where there's much larger disparities.
Well, that's a hint.
So in
to
those
some of the
areas where
private
you
plans.
have large disparities, we get quite a bit of take-up. In areas where there's little disparity, it doesn't really show us very much of a change.
Another comment on this or the other? question?
Just on the whole dynamic, I think what's important to bear in mind about the Lewin analysis is that it is based on the prices. Your point is just price taking. Employers, and you could ask people on this panel, employers make decisions based on more than price in healthcare. This is a very important.
Is that a valid point? May I ask for corroboration?
One more, and then I think we got to move on.
Okay. I would hope so, because I would hope that we'd have a little more creativity in the private market. We actually need that competition because this is too big for any one response. Many of us feel that way, and I think that's a feature of the public option, is that it will be competition and it will be a competitive marketplace. In my congressional district, it isn't competitive at all. It's rural, and there's only one private provider. So, this is a sorely needed situation. I'll yield back, Mr. Chairman.
Mr. Gingrey.